Okay, we're at the Franklin Township Town Hall meeting. Thank you, everyone, for joining us. I'm going to go out of the usual order because, as most of you know, I work at JFK Hospital. I am not on the front lines, but I have Dr. Zacharatos, who works with me at JFK. He normally does vascular stroke type things and works with stroke patients. But because of what's going on, he's been retasked to take care of COVID-19 patients. He's actually on shift now, but was able to take a few moments out of his time to speak to us. And Doctor, why don't you tell us, give us some insights to what's going on there. We see you dressed in a face mask and to protect your eyes and a mask to protect your respiration. Why don't you tell us what's going on?
Thank you, Dr. Kramer. Good evening, everybody. My name is Haralabo Zacharatos. I'm one of the neurocritical care, neurointerventional docs here at JFK. And what you see is a face mask, and there's an eye shield, eye protection. And underneath the surgical mask is an N95 mask also to have a double coverage for the respiratory droplets. I'm also wearing 2 head caps so to avoid the droplets resting on my hair and my head. On my feet, I have shoe covers that extend over my shins, try to minimize any exposure. And when we go into the rooms, most of the patients are ventilated. That means they have a tube down their throat helping them breathe. And we're exposing ourselves to the respiratory droplets, try to limit our exposure as much as possible with the most personal protection equipment that we can find. As you know, that's been the limiting resource, especially early on with the surge of these COVID-19 infections. Once a person enters the ICU, they've become very critically ill. The reason to enter into an ICU is because they have respiratory problems or severe problems with breathing. Having watched patients now come in over the last few weeks, the interesting part of their story, I go back to the beginning in terms of how they got infected, how they got exposed, how long they were at home, how long they were in the hospital. And so the interesting part is the way that people have been exposed. And there's a variety of ways that people get exposure to the virus that causes the COVID-19. One way is by not washing hands after you've touched the contact surface, and then you rub your eyes, rub your nose, rub your ears, and that's a direct access into the respiratory tract. Because the virus likes to go up into the nostril, the mucous membranes of the nostril, into the back of the throat, seed the membrane, and then go down into the respiratory tract. So a few common ways that this virus can get exposure is some simple things: going to the supermarket, exchanging the money from the cashier, boxes being delivered, even food delivery. You have to be very careful washing your hands and making sure you almost assume everybody has the ability to transmit, to take the utmost precautions. Because unfortunately right now in my world that I'm in, I'm seeing the sickest of sick and the critically ill patients. And I have a very skewed view of this because I can see how far the progression of the disease goes. And that's what we're talking about, the 5% of the people. So 95% of the people, 80% of the people will recover with asymptomatic or mild symptoms. But there's this 10% and then the 5% that are super critically ill, that once they get on a ventilator, is extremely hard to get off the ventilator because they progress into serious respiratory issues, serious cardiac issues, and serious kidney failure. So a person can develop multiple system organ failure and we see it affects the lungs, and you hear this ARDS term being used in the news media. You can get renal failure leading to dialysis. And we watch very carefully certain markers in the blood. And as these markers start to climb, that means that the body is actively working against itself. And one of the reason why you hear people monitoring for fevers is because the fever is the outward manifestation of the body fighting the virus. And the fever is actually a very strong indication that something is wrong. A fever is meant to destroy bacteria, destroy that virus, and typically the person can recover from it. But as you continue to have a fever, one of the early warning signs of a COVID-19 infection for me is high fever. I know that somebody is going through a process that they can significantly not recover from. The next step is to look at how well you're breathing. In the news, you hear about holding your breath for 10 or 15 seconds and seeing if you can maintain that. In practical terms, if you put your finger in a pulse ox machine, some people, when they come into the emergency room, because they've waited for so long, their pulse ox, which should be around 98, 99, 100%, can be around 70%, 75. So some of the early warning signs of fever and having difficulty breathing, and it manifests into an oxygen saturation that's low. What I've really come to be convinced about is if we treat early and we catch certain people at a certain point, we can prevent intubation. But a lot of this is education done even before coming to the hospital. Unfortunately, in my brief career in medicine, I have never heard of more intubations through the emergency room. But in the last 2 weeks, it's become a very common thing because people are coming too late. They're trying to fight it off. Initially, people believe it's a slight pneumonia or a viral pneumonia or a bacterial pneumonia, and they come a little bit too late until they get to the point where they can't tolerate things at home, or they're coming in confused because they're scared to come to the emergency room. There are certain treatments that we can use. Everything is currently being studied. The only thing we know for sure is that the virus, once it starts, there is not a treatment for it. There is anecdotal evidence for a variety of different medicines, but currently everything is under investigation. So you've heard of Plaquenil, which is the other term for hydroxychloroquine. That's a medicine that has been tried in combination with something called a Z-Pak, Zithromax. That's a antibacterial drug. Recently, there's been a publication showing that in the late stage of this virus, there's not been an improvement in the person's outcome or ability to come off the machine with purely hydroxychloroquine. And I would say anecdotally, that's pretty accurate. Studies are currently, yes.
So doctor, if someone is at home, maybe they've tested positive, maybe they're highly suspicious that they are positive, at what point should they come in?
I think if they have a situation where they have persistent fever and they may or may not feel short of breath, but they're demonstrating that they're deconditioned, where they can't walk the length of the kitchen or they get winded going up the stairs, that's a sure sign that something is wrong. And as much as nobody wants to go to the emergency room, especially under these circumstances, you need to get to an emergency room because something active is going on. And you can fight it with Tylenol, the fever, but that persistent, it's not a coincidence nowadays. I assume everybody is positive with the infection with those circumstances, especially in our neighborhood, our location, because there's a large volume of people with it. So you can call the primary doctor. or come to the emergency room for evaluation. Because when you catch this early, you can slow it down through different medicines that we have.
And what do you mean by persistent fever? An hour, 2 hours, 5 hours?
Sure. I think if your body temperature goes up 101, 102, and that's not normal for you, then that's something wrong. If your body is, it could be at any point of time, I think anything that's out of the ordinary. And usually it's more of a persistent fever, 3 to 4 hours, because that means that something's wrong. The body's fighting something.
Okay. Do you need to get back?
No, we can continue talking. That's fine.
Okay. How many doctors are working with you, doctors and nurses? How many people are let me rephrase the question. This is not your normal job.
Yes.
How many people do you think have been taken from their normal jobs to do what you're doing?
Depending on the region, everybody in the northeast, the metro area, all the elective surgeries have been on hold. That means that all the physicians then have been reassigned to support the emergency room, the medical floors, and the intensive care units, as well as the drive-through testing, in order to expand the army of people that can provide the help to our patients. That includes also administrative staff and nursing staff. So I would say, as an example, our division has been repurposed, and we were on an every 6-hour schedule covering the intensive care unit. And that's what we do. That's going to be our lives for the next few months.
Do either members of our press have a question for the doctor?
I need some special bags of information.
Malik, do you have a question?
Yes, you had mentioned that some of the places that you've mapped back that people were catching COVID-19 were tracing back to packages delivered to their homes and money that you exchange in supermarkets. Did I hear that correctly?
Oh yes, it came to my attention when some of our patients were getting it, and the only point of contact, because they were very diligent about staying home, only points of contact were either the mail, the letters, or different box deliveries from outside. And then we started really paying attention and advising our other patients and their families just to take an extra precaution. The virus itself will stay on cardboard for around 3 days. So if you get a package, keep it in the garage for 3 to 5 days, then use gloves, take it out of the external package, take whatever's inside out, wipe it down a little bit, take that extra few minutes. It seems like an annoyance, but taking that extra careful step really significantly reduces the risk of exposure.
What about in supermarkets, like when people bring home groceries? Do you recommend any kind of process that people should take when bringing home groceries?
I take it that extra step. I do recommend whatever you can wipe down, and even wipe down the surface that stuff was on, then taking the glove off, throwing the glove away, then washing your hands. And even when you go to the supermarket, take your clothes off before you enter your house, put it in a bag, wash it immediately, go take a shower. Some of these things I really have had to think about it, because I'm in the middle of the fire here, and all of us, our nursing staff, our physicians, anybody coming through the ICU, this is how we deal with things. So I correlate that out into the public, because I see how people have gotten infected. And granted, it's a small minority of the patients, but you never know who is going to progress to this. And the age that we've seen has spanned from young people in their 20s to the old population. So you never know. It's not just specifically a an older person's problem. Anyone can get this.
Mr. Bowman, do you have a question?
Thanks, Mayor. I had a little issue getting myself unmuted. Doctor, has your hospital received any from RWJ Somerset? Do you know?
Have we received any patients from RWJ Somerset? That I can't speak to. I don't know.
Okay. You mentioned that the age range is quite vast. Can you sort of percentage that? Can you qualify that, I should say? More.
I think we're in line with the data that you're seeing publicly put out by the studies. I would say that we're seeing more men being affected as well.
Okay, thanks.
Doctor, there's a question about the relationship and the timing and sequence in terms of onset of fever and respiratory issues.
Sure. The way that, and anecdotally from my exposure with my patients here, it starts off with a small cold, runny nose, or it can be also you lose your sense of smell, and that may be the only symptom. Then it could start to develop a dry cough or persistent cough, and start to feel like it takes a little bit more to do things that you normally would be able to do, and then it can come and it kick in the acute need to breathe and that feeling that you have air hunger. One of the things that we're seeing that our patients are doing, give me 1 second, guys, I'm sorry.
Mr. Patel, the guy that came in, I don't know if you guys looked over his lab work, but his sodium is 174.
Okay.
He's on half an S.
I'm keeping things on mute.
Yeah, okay.
So again, for those listening, I appreciate you all restricting your comments to questions. I'm going to go back to the doctor now. Okay, you're unmuted.
So the question is, how do you know the progression of the symptoms? And when you feel like you can't do certain things that you normally can do, or you feel a significant inability to just have take a normal breath, that's where I would be very concerned.
And if for those who are on the call, some of the questions that are being asked were previously answered. You may have joined after they are answered, and we will have this recorded so you'll be able to review them. Any other questions?
I have a question. This is Chanel Robinson. So people are using gloves and they have a false sense of security. At every touch point, should they be changing their gloves?
Once you use one pair of gloves, it's a great question, because there's some really great YouTube clips about this where somebody touches paint. And one really good example is a person washing their hands and how many times it really takes to get all of the surfaces of your nails and all of the bottom and top surfaces of the arm and the hand. So it takes about 20 to 30 seconds to really do this in a very coordinated manner. Once you use a glove, then you have to be really careful to not want to reuse it. And there's a very specific way you got to take it off from the underside where it meets your wrist and roll it over you. And then the same thing for the other clean hand. When you take the other used, there was a meme that I saw, and it was a man in a supermarket wearing gloves, and he had a Cheetos bag open, and using those gloves that he went throughout the whole store, he was eating his Cheetos. So that's not the appropriate way to use the gloves. But you want to use the gloves in one manner, one time, and then throw it away. And you just have to be very conscientious about not touching your face with those gloves, not touching any other surface.
So there's a question about handling groceries, and there's someone who sprays down products, boxes with alcohol. And if they do that, is it okay to then use that product the same day?
To be safe, because I tell you from my own experience, to be safe, I would hold it. If I don't need it for the next 3 days, I just leave it aside. But I like that added security. I'm with you on that.
Yes, I have a question, if I can be heard.
Yes.
Yes, you're on, PJ.
Yes, hi. Thank you, doctor, for taking the time to answer these questions. There are new testing methodologies that have been launched in Somerset and Middlesex counties. In the Raritan Valley Community College, they're, from what I understand, doing the nasal testing, and in the Edison location, the saliva testing is being done. Is there a preferred methodology? Is one more efficacious than the other? Are the results more accurate one way or another? What is your opinion of those current testing methods?
Sure. I think you will have false negatives through both ways. And the swab, having done a few swabs myself, when you have that test done or do it, you have to keep that swab in the upper part of the nose for around 4 to 5 seconds, swabbing it around to increase the ability for whatever's up there to jump onto the actual probe. When you take the swab in the back of the throat, you really have to make sure you get to that back of the throat, similar to when we were kids and you would test for a strep throat. You swab that back of the throat, and that's about 4 to 5 seconds also. That increases the sensitivity. But I think because the testing is in evolution and the commercialization of it has been so fast, I think there is a certain percentage of people that have false negatives that may be positive. So when the symptoms make sense, I err on the side of believing that this person has the infection until I retest them, especially if they're symptomatic.
And the process of retesting, I mean, it's taken quite a while to get basic testing in place, primary testing, to do a second round of testing. It sounds like it's prudent. Is it possible?
It's possible if you definitely have continued persistent symptoms, and the persistent symptoms would be fevers that would be out of proportion, that you just would never have before, or these symptoms. Rita Hanks just came on, and she has experience with the chloroquine and her experience with the virus. What she describes is pretty good for a description for what the general aches and pains of the virus itself. It was spun as though the chloroquine caused these things, but this is actually what you see. And anecdotally, my friends and my patients that have had this describe those exact symptoms.
But would the severity of the symptoms indicate which of the two testing methods currently available would be the more prudent way to go?
Currently, those are the two testing. Hopefully, in a couple of months, we'll be able to have antibody testing.
That was my next question.
Yes, and I think that's definitely an evolution. We'll see the timing of when it comes mainstream, because I think that will, from a practical standpoint, we will have to understand who has antibodies and who has not developed antibodies, because even though the social distancing is really helping flattening out the curve, the people that are really adhering and being careful are not, in theory, not exposing themselves. So it's really important that when society opens up again, you have to have a very heightened sense of, and almost maintaining that sense of what you're doing now, even then, and not let your guard down, because it will be easy to let your guard down. Because that, even though we're flattening the curve, the exposure may still be there. So we're not sure who may end up developing even more severe symptoms. That's something I think about a lot.
Michael, I have a quick question, if I may.
Sure, go ahead, Alex Karazi.
Doctor, at the beginning of your talk, you mentioned about various PPE, but we've also heard about the shortage of personal protective equipment. How is the situation now?
Over time, a lot of institutions, the hospitals have stepped up to provide the PPE to the staff, to the nursing staff, and to the physicians, as well as everybody else that works in the hospitals. And a lot of people have been very generous with their donations. So I would say the biggest problem that we had was so many people got so sick so fast that it put a strain on a system. And once that got corrected, the PPE started to come back in.
So the flattening the curve is very important.
I think absolutely flattening the curve is important, but I think we have to also just keep in mind that there could always be another spike up because we're doing the social distancing. You have to make sure that you don't let your guard down, because until we have an appropriate vaccine, the people that are not been exposed to it, we just don't know who's going to be in that 10% that get really critically ill. Because the percentage-wise, it's in everyone's favor that it's not going to happen. But my personal opinion right now, I have such a skewed view because all I see is the super sick, unfortunately. And so I've gotten to my mind, really, we have to just make sure that we watch out for the patient population, the people that may be at more risk.
So, Doctor, I have a couple questions from you. You have something, Mayor?
Just very quickly, I had heard anecdotally that patients often get sick, start to get better, and then get worse. Are you seeing that?
That's a great point. And that's what we get the benefit of seeing are some of these inflammatory markers in the body. And and usually what happens is when that person has an improvement and then that person then declines, it's usually associated, and typically we're going with the typical story, a high fever. And then when I look at their lab work, their inflammatory markers are high, which tells me that whatever's been happening, that virus is actively working I almost imagine it like a factory, just the virus replicating in the lungs, the heart, the kidneys. It's tremendous to see this. And there are some treatments that we can give to try to prevent that cytokine storm.
Good, Michael.
So, yes, and I'm going to ask everyone to stay muted. So, Doctor, there was a question about 72 hours fever-free without fever reducers. Is that a milestone that means anything to you in terms of maybe turning point for people?
Typically, we want somebody to be symptom-free for around 14 days. So if let's say you're a person that has tested positive and you've gone through a symptom course and you've been 14 days symptom-free, and I'll just use the general definition now of what a plasma donor can be for the community. So if you've been tested as positive with COVID-19 and you're symptom-free for 14 days, you can then get retested at a certain facility. Not every facility will do this. Then you will be eligible to be a plasma donor at any of the local blood centers, like Hackensack Meridian, like the Red Cross, like the New York City Blood Center. And you'll be able to provide your plasma to patients that are critically ill to be able to be used as a treatment.
Okay, Doctor, there's also a question about some of the fatalities that are seen in young people and whether or not that's something that's typically where there are kind of comorbid conditions existing with those folks, or?
You know, there are some people initially that were saying this is a lot of the comorbidities like diabetes, high blood pressure, but it can affect the young population that is, when you look at them, seemingly healthy. They're not vapors, they're not smokers. It really doesn't discriminate. It does affect the let's say the slightly more unhealthy, but you never know, you can't predict who is going to be affected in a severe way.
Just related to that, with regard to vaping, anecdotally, are you seeing with younger people any issues with that, or is that just more natural?
I wouldn't be able to comment on it because not enough data on that.
Yeah.
But the few that we've seen, they have not been person that smokes or vapes.
Understood. One follow-up on the PPE. There was a question about people making face shields at home and whether or not there is a need or a place recommended for donation.
Right now, any hospital would appreciate the donations of the PPEs, even a cloth PPE. And there are some great YouTube videos about socks being turned into PPEs. And now you hear a lot of the fashion designer brands have turned to making masks. Even that small piece of the PPE in the general public will reduce the transmission of the respiratory droplets by 40 to 50%. So it's reasonable to have that, but in the hospital, we need a higher grade for that.
On that note, there's some people in town who are making masks themselves that are double cloth with an insert and
Sure.
Coffee filters or shop cloth, those kinds of things. Do you have any information on what is most effective and what people should be using in those circumstances?
Even the N95, which is a standardized mask, does not completely remove the possibility of the COVID to come into our mucous membranes. It significantly blocks the majority of it, but not enough. There's a small percentage that does get through. So you just have to keep that in mind when you use any other type of mask, because you'll have a higher potential to get that airway in. But that's why we talk about social distancing, to stay around 6 feet so that those respiratory droplets don't really get a chance, or not a lot of the viral load gets a chance to go into the mucous membrane.
One last question that I have that somebody submitted is just anything preventative that might be recommended, be it vitamins or hydration or this or that. Is it not really anything to be done, or is there something that people might think about?
In the early studies that were published from China, people were using vitamin C and zinc, and I think that's reasonable to use. That does not completely prevent or it does not completely prevent the virus from entering, but I think in any way, if anything helps and we can prevent the progression to a full-blown critical illness, I think it's worthwhile using. The benefit outweighs the risk if you take it in the correct dose.
Right. Is that a part of any treatment protocol, vitamins?
Early on, some people will add on zinc and some people will add on vitamin C, but that's very dependent, because again, there's no standardized treatment. Anecdotally, we understand there's certain things that work and certain things that don't work.
Chanel
It's being tested.
Any hard evidence on it? I got you.
Chanel has her hand up. Did you have a question, Chanel?
Yes, in regards to the saliva method of collecting for testing, the average person, or those layman people or not medical, think that it's just a simple or a matter of the saliva that sits on your tongue or in your mouth, not understanding that that collection has to have phlegm or sputum in it, and you have to fill up the collection container to a certain amount for it to be tested. So what are your thoughts?
In all honesty, I have not done a saliva test, so I cannot speak to that, unfortunately. The only thing I can speak to is the nasopharyngeal swab, because that's what I have done, and I understand the nuances behind it. So I apologize.
No, quite all right. Thank you.
So if there are no more questions, Mr. Mayor?
Yeah, I think we should let the doctor go. I super appreciate you doing this. I'll buy you a cup of coffee when it's
No need, my pleasure. I want everyone to stay safe just be careful. It's not so much of fear mongering. That's not my intention. My intention is just to keep, you almost have to really pay attention to the things that we normally used to do without thinking about. Now has become something that you have to question everything and every point of contact. So please stay safe, everyone. Thank you for your time.
Everyone, please stay home so he can stay safe, please.
So just so everyone knows, that was Dr. Zakharatos at JFK Hospital, who was reassigned to ICU. Mr. Mayor, is that correct?
That's right.
Yep. Okay.
Thank you.
Thank you, everybody.
Bye-bye.
Bye-bye. Thank you.
So, you know what, I'm gonna forego my comments for tonight, because we're already 40 minutes into this. That was a great guest. Why don't you, Michael, run the show?
Well, I'll move to Freeholder Director Chanel Robinson. If you want to give an update on anything county related.
Yes, I'll be very brief. We had our first day of testing today. We started off the day with 150 people registered for testing. We actually conducted 91 tests. 10 people were turned away due to not having a prescription or not being a Hunterdon or Somerset County resident. Tomorrow, we have 105 people already registered. And then we're going to then test again on Monday. So at this point, I have given direction to go ahead and order another set of test kits, another lot of test kits, excuse me, so that we can continue the testing. The discussion or the decision is still up in the air with regards to the saliva testing. I understand that Middlesex County had their testing today. And some of the challenges have been where they're providing videos for those who are opting for the saliva test and what they need to do. There are some restrictions like no smoking, no eating, and things of that nature, no coffee, maybe 30 minutes before you're to give your sample. So just like with anything, there's nothing 100%, but we're optimistic that if people continue to do the social distancing and continue with testing, and if we can get to a point where we could do universal testing, that would be great. The concern for Somerset County has been, in my position, has been our numbers may be relatively low in comparison, but because our residents did not have easy access to testing, we don't know what we don't know, and that's a problem. So thank you for allowing me this time to speak, and again, stay safe, wash your hands, and be well, everyone.
So I have a few questions for you, Freeholder Director. So when someone registers, do they get a time to come?
They don't get necessarily a time slot. We have from 10 a.m. to 1 p.m. I could tell you this morning, there was probably 10 or 15 cars at the most at any given time that I observed, which I was there for the first hour. From check-in to collecting a sample to checking out, meaning driving out of the test site, was an average of 7 minutes. We were able to end the day with 5.5 to 6 minutes per test.
And how long will it take for people to get their tests back?
2 business days.
Okay. Very good.
Okay. Thank you, Freeholder Director Robinson. Mr. Mayor, I was going to ask for the updates to be done and for people to hold their questions, or I'll address them after everyone's given that update. Does that sound okay to you?
Yes. Just one thing I want to mention that we do have Andrew Hodgelick here. He's the financial advisor for the town. He's not really here in that capacity. He's more here because he's a CPA and people probably have some tax questions. He's not a tax expert, but he knows more about it than the average bear. So if people have those questions under your direction, have them ask them when they do.
Yep, absolutely. So we'll move to him after we get the panel updates. And so I would ask for Township Manager Vornlocker to take it away. Bob?
Actually, Michael, I think that at this point in the night, there's very little that I have to update from last week. Things have just pretty much remained status quo for the township staff. Nothing has changed dramatically. And I gave a report at the council meeting. People can also review that on our township website. And I'd rather hear from other people who are new to this forum and also answer questions.
Sure, fair enough. Thank you, sir. And Lieutenant Rizzo, anything on the police end?
Nothing new from last week. Again, I would mirror what Mr. Vornlocker said.
Okay, fair enough.
My one police comment is people still are telling me I saw social distancing infractions here or there. That's fine. You can tell me after you call the police. Call the police as soon as you can after you see it. And then you're welcome to let me know. But if you send me a Facebook message, I may see that 8 hours later. So it's not going to help break it up. But please call the police.
To just mirror that very quickly, since we've started this, I just did a quick search. We've only had 31 calls of people saying that there were violations of the executive order, and I know that the mayor's received many more than that. So you're not calling the police, you're calling the mayor. You're not getting the level of service that you need.
You heard it here. All right. Thank you, Lieutenant Rizzo. Why don't we go Councilman Galtieri, if there's any updates on residents helping residents, sir, take it away.
Yep. So I'll be brief. We are seeing an uptick in calls, requests for help. So please reach out. I can provide that there is a much easier website now to go to. It's rhrfranklin.org. So no memorizing the Facebook page or the other URL that we had. Again, it's rhrfranklin.org. And again, it's set up. We've got over 100 volunteers registered that are, they're not instantaneous because they are volunteers, but they're trying to help people within a day or two and overall just keep the at-risk community at home. So that's residents helping residents. As far as our food banks and food pantries, one of the new requests are for bags even. And I was part of the conversation that said we need disposable, or we were trying to get rid of disposable bags, but right now the food pantries are asking for plastic or paper bags, or if somebody has a ton of reusable bags available, just to donate to help fill packages and needs. So those are the requests right now. And please try to help the food bank if you can with the virtual food drive going on. And we still are collecting food, non-perishable items at the senior center as well at 505 DeMont Lane. And that's all I have.
So Councilman, is it, I think I heard that there was, kind of increased need and activity with the residents helping residents. Is that your understanding?
Yeah, so we set things up and it was slow. I would say that we've gone at least 2 to 3-fold now in requests for help in just the past 2 to 3 days. So there are starting to be needs, but we can still meet them. And if you still have time or are willing to volunteer, we're still registering volunteers as well. We'll never turn away help.
And I'm just curious if maybe we want to look into if we're going to be donating used shopping bags to the food bank if they need to sit for any period of time.
Yeah, absolutely. I mean, that's the extreme last resort. There was a request out to our business community to see if they have bags around that they can do the brand new out of fresh in the box packs that they can donate. So that's always well, contrary to what we were trying to achieve, but that is the ideal scenario right now. So if some of our businesses have any that they can spare, that would be the best case. And that's for the Franklin Food Bank and the food pantry at Zarephath as well. And
if you're going to use reusable bags, you need to have washable reusable bags and wash them after every use. Soap and water kills this thing, and washing in a washing machine kills this thing. So we wash every time, and be careful how you bring it through the house to get to your washing machine.
That's all I have. Thank you.
Mayor? Yep. I'm sorry. Did you have something more, Councilman? You're good? Okay. And then, so I'll move to Superintendent John Ravalli from Franklin Township Public Schools.
Thanks, Michael. I just want to say, as I think most of you realize, the challenge of educating our students in this new normal has been quite challenging for us all. I just wanted to thank our families, thank our students, thank our faculty for the job that they're doing and their continued efforts. It's not easy to build a plane as we fly it, but as you can imagine, we are doing the best we can. Phase 1 and 2, we built with the thought and hope of returning. Phase 3, we're going to do a little bit differently. And that will begin April 30th. And we've got a lot of information coming out about grading and whatnot. What I would ask, and I want to try and leverage this meeting if I could, and hopefully folks will take advantage of this opportunity. We have a link on our website right now that we just put up today. That is a survey. We want to hear from folks what their struggles are, what's going on that's bad, maybe a positive thing or two that perhaps is going well with remote learning. But most importantly, we want to hear about what we need to do better, what we need to do that can help our parents get through some of this. We recognize that it's a new challenge for many of our parents as well. So we want to hear from you. We're going to begin, we started our phase 3 building, but we will be building most of it through next week and the week after. And now would be the time to get that information to us. Facebook comments and social media comments are great, but they're hard to filter through. This would be the best vehicle for you to get information to me so I can get it to our design team and we can do something that would be helpful for all. So again, that's online. I believe we've asked a few of our folks, our PTSO members, to share that link via Facebook, but you need to go on to our website so we can collect that information in a meaningful way and get it in the hands of our design team. So, okay, thank you.
Thank you, sir. Okay, so let's move to Andrew Hodgelik. And Andrew is here not in his capacity as financial advisory to the township, but rather just based on his professional knowledge of all things financial, right? So if there are questions, specific questions people have, you can put them in the comment section. But Mr. Hodgelik, if you want to take it away, if you have an overview you want to share.
Sure. Just very briefly, obviously, a lot going on, and it's hard to actually keep track of all the new legislation that's out there. The first thing that I think most residents would be interested about is these economic impact payments. Those checks are supposed to start to be going out very, very soon. That's $1,200 per individual, $2,400 for a married couple. And again, there are limits with respect to your income that you receive, that you earned in 18 or 19. The checks that are going to be going out are going to be based on your 2018 tax return, or if you filed your 2019 tax return. Also, if you haven't filed a return, but you are a Social Security recipient, then also you should be getting those checks automatically. And the IRS actually has set up a website on that. It's a pretty decent website. You can actually go to that to track your what the status is of your economic impact payment. And in terms of the tax law that changed with the CARES Act, the only one that might be of interest to many people is that if you're standard deduction is a high limit these days, and particularly with the impact of the SALT legislation back a few years ago, we can't deduct other than $10,000 our local, state, or income taxes. But they did allow this year, if you are a standard deduction filer, a $300 above the line deduction for charitable contributions. So hopefully people that are making contributions, they will be able to get some benefit out of that. Lastly, there are some other individual items that can help the individual. I think one of the larger ones would be that if you early withdrawal from your IRA or qualified plan, there used to be a 10% penalty on that. They've done away with that penalty. So if you do find the need to get some money from your retirement plan, you won't have to pay that penalty. Obviously, the income taxes will still be required, but not the penalty. And lastly, obviously, hopefully everyone knows about the PPP application for small businesses or the EIDL loans. And there are some issues with that, and there's no longer any funding for the PPP loans at this point. Just got an email early this afternoon. The U.S. Chamber of Commerce has a program now. It's called Save Small Business Initiatives. That's a grant up to $5,000 for areas that are affected by the virus. Now, I didn't see anything where I could actually determine which territories or states qualify for this, but it may not be a bad idea for folks to take a look at that also. So again, that's the U.S. Chamber of Commerce, Save Small Business Initiatives up to a $5,000 grant. So those are all my prepared remarks. Anything else that anybody has any questions on, I'd be happy to try to respond.
I can kick off one, and that is that, so that's 1,200 for adults what is the dependent amount and the age cutoff?
So those are good questions. You know what, I'm not all that up on it. I believe if you're, what did I find? I get the IRS site here if I can find it.
I'm pretty sure it's 517.
That's right, 500, exactly right. That's what it is, yeah. But so in order to qualify though, I think if you're just a dependent, I'm not sure you're gonna qualify other than having someone else apply who you're the dependent of applying, and then also you're gonna receive those funds based on who you are dependent to applying. Like for example, your child, the child's not gonna apply being a dependent.
Right, exactly. Okay, and I do have, nope. Is there anyone on the panel?
Michael, I have something for the interface.
Yeah, just hold on to that, Alex. We're coming to you next.
Okay.
I just want to make sure we have all the questions. Any other questions for Andrew? So I'm not seeing them on the comments thread. So I think we're good, Andrew. Thank you so much.
Thank you very much.
Appreciate you coming on. So now we're going to move over to Dr. Karazi. Sorry, Mr. Mayor, did you want to say something? Oh, sorry. Dr. Karazi, go ahead, take it away.
Okay, good evening, everybody. And Michael, thank you very much, Mr. Mayor and everybody else. I have two items that I'd like to share. The first one is an idea which actually was suggested by Michael to install lights around gazebo to recognize and show support for those who grieve and remember those who lost due to COVID-19. He asked the Franklin Township Interfaith Council to see if they can initiate or sponsor such an initiative. And we had discussed among our executive committee members, and we all agreed that spreading the lights is a great symbol of religious organization. So we will love to do that. And the color that was suggested and we have chosen is blue color, which would be a common and yet will have a striking appearance against the white of the gazebo, which we will use it for this recognition. So the lights have been ordered. And if all goes well, we are expecting to have the lighting event next Thursday, Michael, if I understand, at 7 o'clock, something like that.
Well, if everything goes well and we want to add it to this call, we could have kind of really just have some kind of opening, ceremony of some kind, some comments, remarks.
Great. And the second one actually is very important one. You heard doctors saying about the personal protective equipment and shortage of those kind of stuff. We know the bravery of health professional. So one of the things that we have started in Franklin Township Interfaith Council is a fundraising effort to help purchase personal protective equipment and donate to local hospitals and local health related organizations. And so if anybody is wishing to participate and donate, they can visit our website, which is abbreviation of Franklin Township Interfaith Council, which is ftwpic.faith. And they can see the details and they can donate. But I also, in line with the same thing, I like to let everyone know that Razi Health Foundation, they will donate 4,000 N95 masks to local hospitals and our police department and other facilities that serves those in need. The Rosie Health Foundation is a 35-year NGO, which is registered in New York. I have been serving at their board, and I'm a president for the last 7 years. And when I told them about the shortage of PPE, and they graciously agreed to donate to purchase, which is about $10,000 donation for this purpose. So we are very pleased that hopefully this next few days, the hospital will receive these donations.
So Freeholder
Those are all I have.
Robinson, does our test facility still need PPE?
Yes, we gave 50 last week, which we had in our hand to police department, and we are planning to donate 450 additional.
Okay.
Yes, we're also a supplier through OEM, supporting our municipalities as well as the one hospital within our county, which is Robert Wood Johnson, Somerset. So it's not just, we're not only just applying for the test site, but first responders, the municipalities, as quickly as it's coming in, it's going out. And so we're actually taking stock and inventory this weekend, because we just got, thank you, Mr. Mayor, for your contact. We have signed a waiver and we will go to Princeton to pick up those masks.
Freeholder Director, I am your mayor, and you look very tired to me. I am giving you every excuse in the world. She has been working unbelievably hard. So why don't you sign off and maybe get dinner? Would you do that for us?
I will, and thank you so much for that. I am tired. One last thing I say is we got approved and partnering with the Somerset County Business Partnership to actually have a economic recovery task force. So we're thinking about the financial condition that we will be in post-COVID. So we're having those conversations. And Mr. Mayor, I sent you a text. So if you take a look at it, some of the concerns as a resident of Franklin, people are doing spring cleaning, and I'm seeing that they're using the clothing drop boxes as their dumpster. So please be mindful, hold on to your recyclables. We will eventually open up for the county to take in household hazardous, as well as any of those things that you may not be able to put in your regular garbage. But please be mindful, and Earth Day is coming up, so we all need to be extra mindful with regards to what we're throwing away. So thank you so much.
Could I just ask you a quick?
Okay, you get some sleep and get some dinner, and not in that order, and then you'll be hardworking tomorrow. I know you will.
Can I just ask her a question before she leaves? Is that possible, real quick, just based on what you said earlier?
Sure.
Thank you. You said that you had placed another order for test kits. Can you tell me how many?
We're looking at a lot of 500.
500. So that's what, another three days?
Something like that. Depends on the rate. Like probably another 3.5 days.
Okay.
But it also depends on what they have available. We had already pre-ordered the first 1,000.
Okay.
So we're just actually having them delivered.
Okay, thank you for your order, Director.
All right, thank you so much.
And
be well, everyone.
Thank you. And thank you, Dr. Krause from Franklin Township Interfaith Council. There is a question here, jumping back. I don't know, maybe Bob Vornlocker might want to field it, but in relation to property tax deadlines for
so there's a couple here that I can probably answer. I know one is addressed to the mayor, but I'm going through the list on Facebook. As far as our property taxes delayed for this quarter, the answer is no. Property taxes are governed by state law, not by municipal ordinance. The municipal government has no control over property taxes, nor do they have any control over the grace period granted on property taxes. It's been a heated discussion in the state legislature. The state assembly had originally passed a bill to address extending the grace periods. However, the Senate had objections based on a number of different issues with the legislation, and there's been no further action on it. So at this time, it's now the, I guess, 16th of April. Taxes are due on May 1st with a 10-day extension. as per state law. Again, the municipality has no control over this. It's governed by state law. So that was one question I saw. There's another question, and I'm sure the mayor will also want to chime in on this, and it deals with our parks. And the question is, and I'll paraphrase, is that people are out biking and walking in the neighborhoods, and that somehow those neighborhoods are becoming crowded with people. And could we, in fact, either open up parks or trails? The reality is that among those 31 reports to the police department and many other reports, our parks became an issue. The parks at the state level became an issue. The parks at the county became an issue. And here locally in Franklin, our parks became an issue. And I continue to see it. And this comment does say that people are still using the parks. And I'm going to tell you now, and I'll look over at Lieutenant Rizzo there, and I'm hoping that he'll nod his head. Our police department is going to begin to take enforcement action if people are found in those parks. The parks are closed by an emergency declaration of the Township of Franklin, and the state parks and county parks are closed by executive order. And that is a violation of law if you are there. They are closed for a reason. The reason is that people continue to congregate and violate social distancing, and that caused the parks to be closed. And we had a number of incidents here in Franklin where people continued to do it even after we took action and continued to try to plan events within our parks, and we were forced to take this action. It's in the interest of the safety of the people who live in our town, and we're going to continue it for as long as it is necessary. They're not going to be opened. They're closed by executive order, and they're closed by our local declaration of an emergency, and we will continue to enforce it. The parks are being posted, all have been posted with closed signs, and there's going to be emergency no parking signs posted throughout the state park properties. If you go there and you're on the towpath and your car's in the parking lot, you're going to get a motor vehicle ticket. That's it. We're no longer going to be tolerant of this. There are laws in place now that need to be enforced, and they're going to be enforced. So that's the answer to that question. And I don't know that there's any, so there's another question. Will there be extensions for car inspections that are expiring within the next few months? Unfortunately, that's a question for the state of New Jersey, not for the Township of Franklin. My belief is that at this point, all expiring motor vehicle inspection and registrations, the state is looking at that to extend those during the time when the motor vehicle agency offices are closed. But you'll have to check with the state on that, not us.
Great, thank you, Township Manager. And one other point is, which I've heard, is that when the parks were open and there were issues, then is it true that diverts, police resources away from other things that may be a priority during this crisis? And then if they're closed and people are going there anyway, then that also diverts police resources away from things that they should be focusing on?
Absolutely. We would ask that our residents comply with the law. And while I can hear comments and see comments about other towns have theirs open or closed, we have 22 parks and open space properties with thousands of acres. It becomes very difficult to control them, and people were violating the premise of social distancing, and they were gathering in those parks and open space properties, and that constitutes a danger to all of the people who live in the town. So the decision was made. There may be other towns that have parks open. Those parks are not the same as ours, and we made the decision based on what we have to deal with here in Franklin Township.
Okay, thank you, Township Manager.
If I could just chime in, I'm on the MVC website right now, and all driver's licenses, non-driver IDs, vehicle registration, and inspections expiring before May 31st have been extended for 2 months. That does not prohibit you from attempting to or renewing online. So inspections are extended for 2 months, but if you have an ID, you can register that, or your vehicles, you can do that online as well.
Great, thank you, Lieutenant Rizzo. So we're obviously this call's happily has gone longer because we had the benefit of having Dr. Zacharotos. But Mr. Mayor, I'll let you chime in, and then I was going to go to any other press questions, but go ahead.
I just saw someone asking about fishing. No, sorry, if it's in a park, you can't be in the park, even if it's just for fishing. It's unfortunate, but that's the rules we have to live by.
Thank you, sir. And so if just take a couple minutes, if you have additional questions, start with Franklin Reporter and Advocate, either Bill or PJ. Do you have any questions for panelists or guests?
I don't have any unless PJ does, but she's not, she's muted. So
You're muted, PJ. Let me, I'll unmute for you. Go ahead.
Okay, great. Thank you. Yes, I do have a question and invite commentary. There was a horrific incident in Sparta Township in Andover in an extended care rehab facility where bodies had been found, 17 of them, and they were hastily stored in a very small makeshift morgue on site, which has to be chilling to anybody who heard this story. My concern is that there are at least 4 such facilities in Franklin Township. The testing that has begun in Edison and at Raritan Valley Community College is for those who can get in their cars and show up. Is there a plan? Is there testing that is going on in these self-contained, obviously close quarters where this virus affects one and all of a sudden it is like lightning and it affects many, if not all? Is there a provision being considered for testing and remediation within these facilities that are in Franklin Township? And therefore also any of the first responders and caregivers who are attending these patients who are typically of an older age bracket with immune systems that are compromised, who are infirm and
Well, somehow she got muted. Oh,
You chopped up there a little bit, PJ. I think you're okay now.
okay. I don't know what you missed, but my concern is that we have 4 such rehab institutions in Franklin Township, and the chance, the likelihood for community spread within these groups is higher than probably the rest of the community, because the opportunities for social distancing somehow are skipping them. The target population within these communities are under one roof. The chance for community spread is obviously much greater because of the confinement, because of the target age range, infirmity range, general health range.
PJ, if you stop, we can answer your question, I think.
Okay, I wasn't sure if I was being heard. Okay, you have my question.
So the answer to your question about the assisted living and long-term care facilities is that they report daily to the Somerset County Office of Emergency Management and the Somerset County Health Department what their status is based on their manpower, their need for PPE, their condition of their patients. So all of the facilities in Franklin Township are monitored on a daily basis, and our Office of Emergency Management is in constant communication with them for their needs. So
that's great.
That's what that's what I can tell you.
And
Thank
testing
you. I
is
appreciate
available.
that.
Testing is available to them.
And testing is absolutely available, and they will test patients if the need arises. They have medical staff that is capable of doing that.
Okay.
Great.
Bill, did you have a follow-up?
No, I wanted to make a point to Franklin Township residents in general. Stop spitting in public. It's gross anyway, and right now it's dangerous. That's really all I wanted to say.
And it's a violation of the township code as well.
Okay.
All right, thank you all. Going to mute everyone, and I'm going to turn this over. Malik, I know you had sent some questions in advance. Did you get them all answered? If not, I'll leave it to you to answer any additional ones. And you're muted. You need to unmute. I'm going to mute. I got you. Go ahead. Go ahead,
Okay.
Malik.
Sorry about that. Yeah, just kind of piggybacking, I mean, yeah, the majority of my questions did get answered, so that's very good, and I appreciate that. One that I did have that kind of piggybacks off of what PJ was saying in regards to our assisted living facilities here in Franklin Township. Have we seen any, because I was speaking to a colleague over in Bridgewater, and we both were saying that our towns have significantly higher numbers, even though we know that the populations kind of would warrant that. However, we're trying to figure out if there's a correlation between the amount of assisted living facilities that we have and the amount of reported cases of COVID-19, in addition to the fatalities that we've been reporting, based on the self-reporting numbers. And to Mr. Vornlocker's point earlier, he did say that they're communicating, those facilities are communicating with the Somerset County Department of Health. So we probably would have more insight to that, or is that something that we just don't want to reveal? Or
It's not about wanting to reveal. I do not get information. I'm not allowed to get information about locations of cases. So I can't comment about that. I don't have the knowledge to comment about that. And the state and health officer are monitoring those sites. So if there is a problem, they are reacting to that problem. But I'm by law, I don't know about those things. I've asked, but they can't tell me.
And to just to add to that, the only people who are privy to locations of those who have tested positive to COVID-19 are under direct orders from the New Jersey Attorney General not to reveal those locations under penalty of law. So our police department, who is provided with the locations for entry into the computer-aided dispatch system, is done on a confidential basis. Even the police officers are only notified should they be dispatched to a location where there's a positive test, are under specific orders from the Attorney General directive to not reveal those locations to anyone. So that is not available to me either.
Other questions, Malik?
No, that was it. That's just kind of disconcerting, especially considering what happened earlier today, what has been reported in a facility. I've even received a couple of emails with people saying that they're trying to talk, but never mind.
No, and I get your point, but telling the public, if I were to know where the deaths are, or are they in the long care facilities, isn't going to prevent what happened there. Other monitoring protocols are going to prevent what happened there.
Right. You know, we can't speak to what the protocol is in Sussex County related to reporting on long-term care facility conditions to a county health department, but I can tell you that there's a daily report filed from all long-term care facilities and group homes to the Somerset County Health Department and now to the Department of Health as a result of what happened in Sussex County.
You did have some education questions or school-based.
Yeah, before we get there, Phil, I had another question from online today, which was about, you had mentioned before about people who might have been transferred out of the county or out of away from the town, and whether they're counted in the numbers of fatalities that are being reported in the differentiation. Do you know, is there any variable with regard to, say, nursing home or subacute rehabs, that kind of thing, if they're transferred to other facilities? Are those numbers coming back to us, or is it?
Again, I am not allowed to be told about location, and I've asked, can it be broken down by zip code or ward or something like that, and they tell me they can't and they shouldn't, and it does come back to, you really need to assume, I know I've said it before and people are probably tired of hearing it, but I'm going to drive it in again. You need to assume everyone you meet is infected and you could catch it from them, and you need to assume you are an asymptomatic carrier and you can infect anyone that you meet. So if you bear that in mind, it becomes a little less important exactly where the locations are.
Yeah, so this question was not so much about location, but whether or not the numbers of fatalities that were Franklin Township residents or people residing in Franklin Township long-term, whether they were all counted in those numbers. So that's it. Okay, so I want to, so we've got the press. We have a couple we do have some education questions, Dr. Ravalli. I can tell you a couple of them right now. I don't know if you're monitoring the comments, but there were questions about.
I'm not a Facebook guy. I apologize.
Good, good. You're better for it. So phase 2, cop printouts of phase 2 materials, and are they available in hard copy anywhere? How's that being managed now, or is it possible?
Right. So what we did was we asked our teachers to identify those that were having trouble with computer or internet access, and we mailed those packets out. So we mailed several hundred packets out over the last 2 days to individuals that we knew had been identified as needing packets. We're asking those that have internet access, and I know some of those activities or some of those folders, which are a bit cumbersome, I agree. In phase 3, we're going to look differently at this, but appear to have a lot of pages. But I want to remind everybody that simply just don't go hit print, because a lot of that is informational text to be read, and the worksheets themselves can be printed and can be worked on in hard copy. We are talking about a variety of different modalities and some changes to next time that will make this even more virtual, but we also have to keep a thought about those that struggle with internet access and struggle with computer access. So the short answer is, if you're looking for paper packets still and you absolutely need them, and I would only ask that if you absolutely need them, because I need to bring folks in to be able to do that. And, obviously the advice is stay at home, right? So we're trying to avoid bringing people in, but if we have to bring people in to print, we'd like to do it on as few occasions as possible. So I'm going to encourage anybody who's looking because they have a need, not because I want, but because they have a need. I'm going to encourage them to reach out to their principal. They'll start to create some lists and we'll see what we can do, but I can't make any promises that that's going to happen right away. Again, this is attendance credit, the first 2 phases, and I recognize that everybody wants a little bit more. That's how it will be in phase 3. But if you're having difficulty, you can, pick and choose right now a little bit, and we can work with you. But if you can, please try and print or work off your computer. If you need a printed copy and still, because you don't have access, contact your principal. They'll create a list and we'll try and minimize going in to make those copies. I know I did get another question.
I have 2 for you.
Oh, go ahead, shoot.
2 or 3. Well, some are related, but one was, so the mandated continuation of remote instruction and building closures, that's May 15th now?
That's May 15th now. But, obviously PA has already closed their schools for the year, and Mayor de Blasio said he closed New York schools for the year, but Governor Cuomo said that that's yet to be revisited. So we're not so certain what's happening on that front.
What else is new?
Yeah, our thought is phase 3 and on. I'll be honest with you, the first 2 phases, we were holding hope and there was a thought that we would be returning. But phase 3 and on, there's going to be our thought is that we're going to plan those as if we're not returning, which is why they're going to look a little bit different. And on Monday, online on Monday, we're going to be actually, Mr. Logren's working on that right now. We have a screencast we're putting together that will be online, that will show folks how grading is going to look in phase 3, how marking periods are going to look for the rest of the year, final exams, all of those kinds of things will be answered in a screencast that's about 12 to 15 minutes long right now, unfortunately, but no other way to do it in a PowerPoint format. We're finishing it up tomorrow, working with our teachers to finish it up, working with our Teachers Association. And then on Monday, we'll be posting it, which will answer a lot of those questions about us going forward and how we're kind of envisioning this.
So related, just talking about summer enrichment, either, having contingencies both for remote instruction or in-person instruction, depending on how things go. Is that all part of sort of like what you all are thinking
Well,
about?
that's what we're thinking about. That won't be addressed on Monday, but what we are doing is we're planning a traditional program right now, while in the background, starting to think about some options for our extended school year, some options for our Title I and Title III programs, which are summer programs for us traditionally. We don't host a traditional summer school. That's usually an outside agency. That's not hosted by the district. They use our facility, but that's a educational commission service. So I'm not so sure what their thoughts are. That would be the Somerset County Educational Service Commission. We haven't had that discussion with them yet. But our extended school year for students with special needs, our Title I and our Title III programs, we've been talking about those this week and the kinds of things we might be able to do. But we also have been told to plan them traditionally. I'm not so certain that that will happen, but of course, that's the hope, that there'll be traditional programs.
Great. I don't know if anybody else got a question.
I see no,
I think we're good.
kayaking and boating is not okay on the canal. Ms. Kipnis, you seem to want to work around the restrictions. Please don't. This is serious. You just saw a friend of mine in armor doing a job he's not accustomed to doing to keep you safe and to keep others safe and keep people alive. A friend of mine is in the hospital now that's intubated. I don't know how else to say it. I'm sorry that you're home. I'm sorry that it's frustrating to not be able to go out. But there are people risking their lives and there are people losing their lives. And I'm sorry I'm getting emotional, but that's the way it is. People are losing their lives. Stay home. If you can walk around the block safely, do that. That's okay. But don't look for ways to work around this, please.
Yep. Thank you, Mr. Mayor. I think that brings us to conclusion. I didn't leave anybody out, right? And questions?
One question for Dr. Rivali, if possible.
Sure, go ahead, Bill.
Go ahead.
Graduation looking right now.
Am I unmuted?
Yes, you are.
Oh, thanks. So Mr. Schmiel is meeting, or did meet, I have not followed back up with him, met with his senior class officers, and he was planning on meeting with at least PTSO and or getting some input from his parents. They're talking about options. There's lots of different options that people are kicking around out there all over the country. As you heard the governor today, he would love for us to be back and do some of those traditional things at the end of the year. But I think we have to plan an alternative just the same. So Mr. Schmiel is going to work with his students, because this is about his students. So he's going to work with his students, get their input, and he's going to present something along with his faculty. And actually, he and I have a meeting tomorrow. I think he's going to provide me with some follow-up, and then he will be giving that information to the 12th grade parents directly when that time comes. But yes, we are certainly thinking about alternative options. It's on our mind. We're hearing around the country what other people are talking about doing. We're seeing how that would generalize to us. But that's going to be a challenge, and not going to be the same no matter what we do. We recognize that. Having 3,500 people support 525 kids, there's nothing like that atmosphere. And it's, one of our most precious events every year. And I have to say, I've been in education 30 years, superintendent for 18, and I was a teacher prior to that at a high school. And I can't remember a time when we didn't have a traditional graduation. So, something we certainly care deeply about, and we're going to do whatever we can for the benefit of our kids. And there's other things we're thinking about too, not to go on, but there's 8th grade promotion, there's yearbook dinner, there's and they may seem trivial to some, but they're important. They're important to 525 kids, I can tell you that. You know, something like a yearbook dinner and the ability to sign my friend's yearbook, who I may never see again. You know, these are all interesting things that you know, we're going to have to overcome somehow. And I don't know how we're going to do it, to be honest with you, but they're things we're thinking about. Some of the other things we're thinking about, 8th grade promotion. We've got Mr. Solomon and Mrs. Rutledge talking about that. Yeah, it's not a graduation and it's, you know, but it is a rite of passage, and it's one that has been around forever and ever and ever. You know, 8th grade ball, which is almost like a mini prom nowadays, and has been an important event for our 8th graders as they move on. Bringing 2 campuses together in the high school gym, which we started a couple of years ago. Another important part of our ceremony. How are we going to do that? Well, we're going to talk with our kids, and we're going to see what our kids want to do, because it's about them. So, and of course, we want to get our parent input as well, especially at that grade 12 level. So we have our principals working on that now, and hopefully we'll be able to reveal some plans, if not, you know, early next month, certainly by mid next month. So, you know, things like the prom too, also something that I'm not so certain about. So
thank you, Dr. Ravelli. I'm going to just wrap it up with one quick thing before I turn it over to you, Mr. Mayor. And we were intending to have a couple of representatives from some nonprofits, Michelle Wilson from Elijah's Promise and Lauren Frary from the Arc of Somerset, just to give some perspectives of some organizations and how they're faring, which, and they're struggling. So, but they're hopefully will be able to make it next week to kind of report on that. I did get, just to give you some indication, you know, Elijah's Promise this time of year might be serving 150 lunches, and now they're pretty much at a 315 average there, and giving a bagged meal to go with people. So, and they're not using any volunteers to comply with social distancing. So there's definitely, you know, a lot of needs. So whether it's franklinfoodbank.org, elijahspromise.org, or other organizations, you know, are helping to alleviate people who are food insecure, and those numbers are growing. Just wanted to kind of put that out there. But Mr. Mayor, if you want to close this out, the floor is yours.
Well, I'd like to thank all the panelists for being here, and I'll give a special thanks when I see him again to my friends at JFK. You know, I said it just a little while ago, stay home if you can. Only go out when you have to. You're saving lives that way. You know, I end a lot of my posts on Facebook with one for all. And we all know the saying is one for all and all for one. But we need to think about the one thing that the one of us can do. What can I do to help? And what you can do for help is all the social distancing that I don't have to repeat. So please, please, please flatten the curve, save lives, save doctors and nurses' lives. Let doctors and nurses see their families that they haven't seen in weeks and may not see for weeks more. Whatever you're sacrificing, others are sacrificing more. I'm sorry for your sacrifice. I truly, truly am. Closing the parks hurt. But if it's going to save lives, that's what you need to do. Please, Franklin, be well.
Thank you, Mr. Mayor, and thank you to Neil Bitwin, who was helping with IT, and also to Jessica Levin Sullivan, who's annotating the call. We'll have a recording up by tomorrow for everyone on YouTube. Have a good night, everyone.